Thank you. My name is Kenneth Ndua, the founder of Stamp Investments, and this is a business that deals with innovative cook stove. We can go to the second slide. Stamp Investment is more about a fire efficient cook stove distribution in Kenya, Tanzania, and Somalia. This is the second slide. Please go to the second slide. And our mission is to produce, market eco stoves through building quality assurance and brand loyalty amongst consumers in Kenya. We have realized majority of the people who bring out their stove from outside there, they don't concentrate on the quality assurance and brand loyalty. And this being a stove that we have designed it locally and it's addressing a certain need. This is our mission. We can go to the other slide on the value proposition. Stamp is aiming to produce an energy conserving stove. This is a multitasking, very efficient biomass stove featuring an innovative built-in jacket that can be filled with 3 liters of water. One of the key innovative thing about the stove is it has a purifier. So you're able to purify that water, whether like if you go to the northern places in Kenya where the water is not clean, the water is first filtered and then it is passed to a water jacket, and then during the cooking process the user is able to simultaneously cook while boiling the water, and they don't need 2 pots for this because all of this is integrated in the stove, and it uses very little fuel. Another good thing about the stove is through some pilot studies we undertook last year and currently even undertaking some, that a family is able to reduce $17.85 monthly. Currently, from our research, a normal household in Kenya uses $23.81 per month in form of fuel. But currently, using this stove, we've been able to reduce that to 5.96, which translates to 75% reduction in fuel cost. This is for families who have been using the 3 stones fire, but now they're using this stove. One of the other good thing is household incurs 0 cost in water sanitization. If you realize, like in Kenya, people use things like water guard, they use chemicals. So with this stove, they incur 0 cost because the fuel they're using for the cooking is the same fuel that is the same energy they're using for sanitizing of the water. This translates to reduction of waterborne diseases. It will translate to reduction in health costs, leaving families with more money to invest in other projects like school, uniforms, and all that. We've also been able to test the stove. It's at tier 2. That is at 29% thermal efficiency, which is so good. Currently, we have also worked on a few things from the lab. So the stove is undergoing some other further tests. And from what is coming from the lab, we are able to hit 36% efficiency. Let's go to the other slide on external environment. One of the things that we know is the influx of inefficient clean cook stoves being dumped in Kenya. We have a lot of these stoves that are being made in the labs outside the country, and everyone, because they know Kenya are spontaneous buyers, they buy these stoves, everybody is bringing them. Another effect that affects the uptake of stoves is the financing. Because sometimes you see, like with the vendors, they need upfront finance to be able to buy the stoves, and also end users, they also need capital, maybe some few loans to from there. The other thing is issues of the smoky kitchens and waterborne disease, which is quite prevalent because of people drinking water that's not boiled or treated. The other side on market analysis. In 2014, our target is to sell 8,500 stoves in 8,500 households. This will be in rural and in urban informal settlements in Kenya. And this one, we have broken it down the way we're going to do it. We have what you call the women self-help groups, who are our key target. The aim of why I did this stove was because of the challenges that women were facing. And I've worked very closely, like also with my team, with the women. And so far, we have identified like 20 women groups who have a membership of around 1,000 women. Each group you find like has 100 women. Maybe they are those who are active or not active. And we are targeting these women who are participating in table banking and farming in 3 areas in Kenya: Kilifi, Kiambu, and Nairobi. And we target between now and December, we'll be able to do 3,000 stoves. We are also targeting CSOs serving vulnerable households in Kilifi, Kiabu and Nairobi. These are NGOs who have been talking to us and who are people in the sanitation field and in water and health issues. We're also targeting SACCOs. These are umbrella people who have come together and they save their funds so they can get loan. We hope to sell 3,000 stoves. We also have got some business people who have taken a lot of keen interest. So we have projected to sell 2,500 stoves between April now and December of 2014. Next slide on the beneficiary analysis. Stove is going to be quite an important element to the target beneficiaries. One of the things I came across was lack of access to clean drinking water amongst many communities I was working with. And having worked in the health sector, I could see there was high prevalence of waterborne diseases such as cholera, which were common due to people drinking contaminated water from shallow wells, which are very common in slums in Kenya and also in the rural areas. I also realized women in the communities would spend a significant amount of their time caring for family and friends who are ill due to waterborne diseases. So there was a need for intervention. I also realized school-going children would spend a lot of amount of time fetching firewood instead of doing schoolwork, which was quite affecting them. Another thing I realized was most people are not able to afford extra fuel needed to boil the water and sanitize it due to high cost of living and low purchasing power. And you can see there that like a typical family in Kenya has an average income of $1.2 per day, and they use 60% of this on fuel, and the remainder is spent on meeting other basic needs, which is solely through buying food and water. So this stove through the last 4 years, as I did the R&D with my team, we realized it solves this problem since a family needs not incur cost in sanitizing the water. That saves their health costs, and this contributes to reduction of waterborne diseases with a big margin. We are currently undertaking another pilot and another one that is starting in May with 500 households for 6 months, because we want to quantify how these stoves contributes to this. The next slide is about a beneficiary story. This is a lady who started using the stove in the year 2013, and you can see what she has said. And because of the benefits she has seen with the stove, less smoky kitchen, about issues to be able to get hot drinking water for their family without incurring costs, being able to bring even other women on board so that they are able to test this stove. The next slide on the key strategies of STAMP. One of the things we realized that one of the key strategies that we have started undertaking currently since January is to strengthen the capacity of 20 community-based groups. We are equipping them with skills to buy and effectively sell 2,000 energy-saving stoves like ERE. If 20 groups now, the ones we are working with, and we continue building their capacity slowly, you'd realize like come 2015, and each group is able to sell 2,000 stoves. That translates to around 40,000 stoves from 20 groups. The other key thing that we have realized is very important is an M&E implementation strategy. We have designed data collection methods and standard reporting procedures and templates. And in January, we undertook a baseline because we wanted to understand some of the people where they are. And we have now a baseline report, and now as we continue doing a pilot in a different area, we are using that as a base. We have also defined the roles and responsibility for implementation of the M&E strategy. I have a team of 5. I have a research officer, I have a project officer, I have a marketing and research assistant, I have a finance person, and each one of them knows what is their role in the M&E strategy. Another key strategy for us that we have been using since 2013 is collaboration and networking. We work very closely with key stakeholders like churches, women groups, SMEs, financials, because we recognize the accountability and transparency. When we are so transparent and accountable, it will add up value and goodwill, especially in creating greater impact and sustainability of project results. Because these are the people who monitor the use of the stove. These are the people who give us feedback. These are the people who see, is the stove working, is the stove not working, and what do you need to improve on, what do you need to do in the marketing, value addition. So we realize that's a very important thing. Another key point in our collaboration is it has provided us with opportunities for cross-running. We have some best practices, and these people also have got some best practices. So we bring on the table all these lessons, and we're able to run. When we've made mistakes, we're able to run. It's also opening us for us great opportunities for resource mobilization, especially for the CBOs, with an eye to the post-project period. We realized that we need, like some of these organizations may need some seed capital, and we are trying to, when we work with them, they're able to fundraise for these, and maybe they're able now to buy the stove, because we don't sell our stove on credit. We can go to the next slide, that is on the value chain. And there are two key components in our value chain. One is the aspect of stove production, and you can see we start with procuring raw materials, and then we have done the stove design, manufacturing. We do it at our facility. We have the inventory, and then we also do direct sales. Another key component in our project is the staff. We have a project officer, as I had earlier said. We have marketing staff, and we have an accountant, and there is me now who is in charge of the project and involved so much in R&D. And we are also working under the stove and the manufacturing with a technical institution, at teaching institution, whereby we are working with their students in this. And you can see we do our marketing activities and our financial services. We target the customer and the after-sales services. And then we also target with the direct sales, the third-party distributors. We can go to the next slide on the business model. Our business model is very simple. The cook stove would be manufactured and produced in Kenya. This is stamp. We have set up a facility through a grant. We received a grant. I'll be talking about it down there. We've been able to receive a grant of $213,000 in tranches. The first one came in November last year. That was to set up a facility. And this other grant is the current grant that we are about to receive by the middle of this month, is for the thorough research and be able to prove that this stove is working. We are also distributing through established distributors who have uptake arrangement with us. We've realized that we don't want to manufacture stoves and put them in a store, and we hold our capital there. So what we are doing is we are doing promotions, and our distributors are the women groups and the SMEs. They are doing they are talking to the people there and doing demos. And then what they do is what we encourage them beginning of mid this month is they'll be paying some upfront money, like half amount of the money for the stove they want. Then we'll manufacture using that. And then when we are about to deliver, they pay the other amount of money, and then we take it to them, and then we can continue with other orders. Currently, we have an uptake of orders of 5,000 stove for people who have committed themselves for the stove. So beginning this month, I will be able to make our 1,500 stove by the end of April. We also have a business model. It is retail model based on commission. Mostly is like our people, when they sell, we give them a commission on top. Like the stove, we're able to give them the stove at $29, and then they're able to sell the stove at $35. So we're able to give them like $6, which is the difference, around 500 shillings, so that they're able to make. And we also use this as a persuasive marketing strategy in order to have target communities buy in, and also in doing physical demonstration with the communities. We can go to the next slide. The next slide. Which is on the metric dashboard. We can look at our financial resources. Currently, we project by 2014 going mostly, and we are talking about maybe we'll be able to make $200,000. Expenses, we project 150, and maybe cash projection, maybe by the end of the year, we're able to save the $50,000. This is in relation to the grants and the amount of the money that you're able to sell. The good thing is, all the stoves that we'll be manufacturing is we don't have to take our own. It's because we are getting money up front. Organizational resources, we have a director who is me, who deals with the business development. We have a project officer who holds a master's degree in environmental studies. We have an admin and accountant who is a qualified accountant. We have marketing officers with two of them, with a person in charge of them. We have technicians from the institution, and fabrication and office equipment. If you look at the transformation, the process activities is 8,500 stove distributed by 2014. And out of the groups of the 20 women groups, with 1,000 women per group, we are targeting to train 200 women as vendors by December 2014. So they'll be distributing even to the far areas that you cannot reach. And the outcome of this is by 2014 is we're able to sell 8,500 households and have the same number of households with clean cook stoves. The impact of this is saving fuel costs, and the families who have money to spend on other necessities every day. In some cases, more efficient stove mean women spend less time looking for fuel and they are more productive. The other impact is clean drinking water, resulting in less sick days and more productivity. And there's a point there we had said it's hard to, but we were able now to secure a grant that is going to help us quantify this by going out to research there with 500 households who have experienced waterborne diseases because of drinking contaminated water. So as we sell the stove, there's also be a group that will be going on with the research. Financial needs and uses, next slide. We are looking for by December, our aim is we are looking by the end of December for $2.2 million from investors for the scaling up of the business. And we're going to use this money, 18% we intend to put it under staff costs, and then stove materials, so that we start with around 15,000 pieces, which will take 10%. We realize our workshop would need automation, so that we're able to produce high quality stoves and even produce more, so that will take 23%. License and regulations, there's a lot that happens around here. There are quite a number of licenses locally, so we need like 2%. Marketing and branding will take 5% of that. We are thinking, because right now we are renting facilities, if we can be able to purchase land and build our own facilities and even separate other people, even that facility, that's an income also, and we're able to have a store and even able to expand, that will take 40%, and then maybe overheads around 2%. So we are willing to give that percent equity for $2.2 million. The next slide is the summary of the whole process. One, we've seen in Kenya that lack of access to clean drinking water is such a major development challenge. And you realize waterborne diseases such as cholera and diarrhea are quite common, and people cannot afford fuel to boil water and sanitize it due to high cost and low purchasing power. Yet this is a very simple way of doing it. And the solution is this stove, which is able to simultaneously sanitize the water and employ marketing and technical staff in the company. We've been able to raise 213 money from Grant Challenges Canada, who has been very supportive to us. So we're able to pilot this. We'll start piloting the stove, establishing a fabrication facility, and employing marketing and technical staff in the company since last year, before I was doing all this all along. Sorry, there's a small mistake there about the 1.2. It's supposed to be 2.2 million to fully automate the facility, scale up production and marketing the stove to all the East African countries. The target of selling 3,000 stoves monthly. And currently we are distributing our stoves through 10 vendors. We include 4 women self-help groups, 2 national circles, and 4 SMEs. These are the people now who have been, we've given around small quantities of the stove that we're producing in a small way, but they will form the group that will also help us in the scale up. So thank you. That is all about it, about our stove. And we hope to get it there. It's been a struggle, but I'm happy when I see smiles and changes in women and children's lives because of using this stove. Thank you.